I'm going to present on the magnitude of sexual and gender-based violence and response interventions among adolescent girls and young women enrolled in DREAMS program during the COVID-19 period in Zimbabwe. I would like to acknowledge PEPFAR, USAID, Ministry of Health and Childcare in Zimbabwe, National AIDS Council, Family Health International, and Zimbabwe Health Interventions. And I'm presenting on behalf of the authors who made this research possible. My presentation outline, I will talk about the background, objectives, methods, results, conclusions, and recommendations. Background. Coronavirus disease 2019, also known as COVID-19, remains a public health concern worldwide, and it has posed some socio-economic challenges worldwide. Then the rapid increase in COVID-19 cases resulted in a lockdown to curb the transmission of the virus. It was noted that during the COVID-19 lockdown period, cases of sexual gender-based violence increased among women as well as girls. Adolescent girls and young women face disproportionately high risk of contracting HIV, with Sub-Saharan Africa most affected. That sexual gender-based violence and socio-cultural harmful practices are some of the key drivers of HIV infections among adolescent girls and young women. The DREAMS program. FHI 360 and Zimbabwe Health Interventions are implementing the DREAMS program, whose goal is to empower adolescent girls and young women and strengthen their families and mobilize communities to prevent HIV infections. And this program is being implemented in 12 districts in Zimbabwe. Objectives of the study: to determine the prevalence of sexual gender-based violence among adolescent girls and young women enrolled in DREAMS program during the COVID-19 period. And secondly, to assess the level of uptake of sexual gender-based violence response interventions among the adolescent girls and young women. Methodology. We conducted a descriptive cross-sectional study using routine program data from the DREAMS program. And for the study population, we used the adolescent girls and young women who were screened and enrolled in the DREAMS program from the period of 1st of October 2020 to the 31st of March 2021. And the study was conducted in 12 districts, which included Bulawayo, Chipinge, Gweru, Makoni, Mazoe, Mtare, Bedbridge, Bulilima, and Siza, Gwanda, Mangwe, and Matovo. In terms of sampling and data collection, we considered all adolescent girls and young women who were screened and enrolled into the DREAMS program from the 1st of October 2020 to the 31st of March 2021. And during that time, survivors of sexual gender-based violence were referred for sexual gender-based violence clinical as well as psychosocial support services. And some of the services which the adolescent girls and young women were referred included sexual transmitted infection screening, HIV testing services, post-exposure prophylaxis, and psychosocial support services and reproductive health services. Screening and enrollment data was captured in DHIS2, which is an online database. And for data analysis, we conducted a chi-square test, which we used to assess the differences in proportion of adolescent girls and young women experiencing sexual gender-based violence among these adolescent girls and young women. Results. A total of 130,477 adolescent girls and young women were assessed, and of these, about half of them were aged 10 to 14. 21% of these adolescent girls and young women were aged 20 to 24 years. And the study found out that the prevalence of sexual gender-based violence was 5.3%, and the 20 to 24-year age group were mostly affected with a prevalence of 11.6%. Factors associated with sexual gender-based violence, among them were alcohol misuse, multiple sexual partners, transactional sex, being married, being out of school, as well as orphanhood. Prevalence of sexual gender-based violence by districts. Districts which were predominantly rural, like Chipinge, Gweru, Makoni, and Mtare districts showed a higher incidence of sexual gender-based violence, as shown in the graph. Proportion of sexual gender-based violence survivors who received services. The study found out that more than 89% of the survivors of sexual gender-based violence indeed received services. And some of the services received were HIV self-testing, which was accessed by 96% of the adolescent girls and young women. Then 95% accessed post-exposure prophylaxis, and 89% accessed post-violence care. Conclusions and recommendations. The study concluded that the sexual gender-based violence prevalence was highest among the 20 to 24-year age group, the married, as well as those with multiple sexual partners and those into transactional sex. And districts with mining and commercial activities like Gweru, Makoni, and Chipinge recorded a high prevalence of sexual gender-based violence. And service uptake for the sexual gender-based violence survivors was high. Recommendations. We recommend customized sexual gender-based violence interventions targeting the 20 to 24-year age group, as well as the districts with the higher sexual gender-based violence proportions like Gweru, Makoni, and Chipinge. Then also we recommend to strengthen sexual gender-based violence service uptake and expand this to other districts. Thank you.